Welcome to this evening's video chat. I'm Cherie with Technomadia, and I'm going to let Chris duck in real quick. This is my normal co-host, Chris, with Technomadia. We have been caravanning the last few weeks with Nina and Paul of WheelingIt, and I thought that since open enrollment for health insurance just started this past weekend, and health insurance for RVers, and there's some new news with the South Dakota stuff up, I thought this would be a fun topic. Well, fun being maybe a stretch of the word.
A good topic.
A good topic, a timely topic to cover. And I thought I would invite my pal Nina here to join me in presenting some of the information, because she and I have both written a lot about it on our blogs about healthcare on the road.
We know more than we want to.
Because we have to. It's a very important topic. It is probably one of the bigger logistical challenges for RVers on the road, is figuring out what to do about healthcare, from insurance to accessing healthcare on the road. And just figuring out and keeping on top of all these logistical hoops.
And it can be potentially one of the things that either allows you to go on the road or not. It's that important, so yes.
It is a pretty important topic. It's one that we've navigated a lot. I know you guys have as well and are right now. So thank you for joining us this evening. This is also our very first chat on live stream. You'll notice there is no advertising like on prior months, so hopefully that'll be a big positive. Today is November 18th. It is about 4:30 p.m. Pacific Standard Time. If it is not that time, you are watching an archive, which means you will not be able to interact with us. Unfortunately, we have not invented time travel. But if that is approximately the time you are watching this, then you are watching this live, and you will be able to ask questions of us. Is there a chat box under there, Chris?
There is a chat box off to the side of the video.
Right, it's off to the side. It kind of looks like, what does it say up here? Like chat here?
Chat with 89 people.
So it says chat with and the number of people that are currently watching. If you just type in there, it's not overly intuitive, but you type up there, you'll be able to interact with us. We're not going to be taking questions till the end. So we will, after she and I have talked your ears off.
We'll let you know when we take questions.
We'll start to ask you when to queue them up. Chris will be reading them to us. But we do ask that you hold the questions for now, because it's very likely they may scroll off the screen and get lost.
And a quick disclaimer before we start is we are not doctors, we are not health insurance brokers, we are not licensed. What we're talking about here today are just our personal experiences and our personal recommendations. There are licensed brokers out there. We recommend that you contact them to talk about specifics with health insurance. We have a very good one that we use, which is Kyle at RVerHealthInsurance.com.
Right. And
he's an RVer himself.
Yes, he's a full-time RVer and an agent. And my understanding is he has joined in on the chat and will be there to help us field any questions that he might be able to. But we are going to be presenting from the perspective of the full-time RVer, which is what we are. For reference, Chris and I have been on the road for about 8.5 years, and you guys are reaching 5 years.
5 years now, yes.
So we have both navigated this, been through many ups and downs with it, and so we'll get right to it.
Yeah, let's get started.
All right, so the first topic we wanted to cover was considerations for healthcare insurance for RVers. We're going to be starting with the assumption that you already know a bit about the health insurance market. You know about subsidies, on exchange, off exchange, about the ACA. If you're not familiar with those, there are some links down on the page that I posted earlier to our healthcare series and Nina's healthcare series.
And also Kyle's link is down there as well. He has some good information on his site too.
Right, so we're not going to be going over healthcare insurance. We're going to be talking about the specifics of what applies to RVers.
Right.
So if you are employed, and of course we're only focusing on non-Medicare, because that's the tricky stuff.
Pre-Medicare RVers. So we're basically looking at people who need to buy individual plans. And I think what you were about to say is if you have been employed in the past, negotiating individual health care is a little different.
Right. So you may have a corporate plan. If you are working remotely for an employer, they may offer you a health insurance plan. Look carefully at what your coverage is going to be while you're traveling. A lot of the healthcare industry and the insurance industry was built up around regional networks with employers. So a lot of the negotiated discounts that come along with health insurance plans are very regionally based. So there might be an HMO or a local network where most of the benefits apply to. So as you start to travel outside of the regional area where your employer is based at, you might find that you have less coverage. Either you're out of network only eligible for emergency services, or there may be restrictions on the amount of healthcare that you can access outside of your home area. So look carefully at the plan that your employer is offering to see if it's even going to be suitable for you on the road before relying on it by starting to work remotely and traveling.
And that kind of brings us to the most important consideration for traveling RVers is having a good network. You want to be able to access as much in-network care as possible as you're traveling around the country. So when you're looking at health insurance plans, if you don't have a corporate plan, is try to look for PPO plans that have a very strong network so that you can stay in network as you travel across the country.
Right. And not just a strong network, but one that is fairly nationwide. Look at the places where you anticipate you're going to be traveling a lot. If you're like us, we just you stay a lot on the West Coast. So a lot of West Coast providers is very important in Nina's selection. Chris and I go all over the country. So we're in Florida, we're visiting family in St. Louis and Texas, and then we're traveling all about. So we look at specific cities when we're looking at a network where we're mostly going to be at, where we might want to access healthcare at. If you're looking at, you're going to quickly find that there's very few nationwide networks out there.
True nationwide networks,
so,
yes.
A lot of them are going to have a lot, regionally based health insurance plans are going to have the networks that are very regionally based, and they might have a few providers outside of that network. So you've got to go and look for the ones that are very nationwide and look specifically. Is there hospitals that are are going to be in network across the country, primary care physicians, specialists that you might need to see. See if there's providers that you're going to be able to access on the road out there.
And kind of the other thing that goes in hand with that, and this is something that is not regulated by the ACA, is whether or not there's an out-of-network cap on your insurance. Basically, if you end up in a hospital somewhere in an accident and you end up out of network, you want there to be a cap on how much you're going to have to spend before your insurance takes care of the rest. And that's something that's not regulated, so it's something you have to specifically look for in the insurance.
Right. So it could be anywhere from, typical seems to be about double of what the in-network cap is, but there's some that are a lot higher, some that are uncapped. So make sure you know about that, and just realize that as a full-time traveler, your odds of when you need health care, it being out of network, are actually much more higher than they are when you're living a stationary lifestyle and have access to the regional network that a local plan might have. So it is very likely, there's a higher likelihood that you may actually reach that out-of-network cap as a traveler. So be very aware of what that cap is and plan that as part of your healthcare budget. And when you're doing health savings plans or however else you're saving to meet your higher deductibles.
Right. And you may actually also end up spending more out of pocket, because a lot of us nomads do tend to take the higher deductible plans and that have HSA accounts, which means maybe not as many coinsurance or no coinsurance at all. So you end up paying maybe more out of pocket to begin with before you get to a point where the plan takes care of the rest.
Right. So we tend to look at our plans. We both have individual PPO plans.
Yep.
Do you have an HSA on yours?
We have an HSA.
And so do Chris and I. So I look at it as more of catastrophic coverage.
That's exactly how we look at it.
We look at it as a protection for us if something major happens, that it protects us from going into debt or losing a lot of our savings. Yep. Instead of, and then we just budget through our HSAs to cover the routine sorts of checkups. Well, checkups are now included in most ACA plans.
Basic checkups, yes.
But for these sorts of preventative care that we might encounter, or the minor things that come up along the way. So we budget for those through the HSA, and then use the plan to protect us from like $100,000 bill.
That's exactly what we do. And your situation may be different if you already have a pre-existing condition or something like that. You may need to look at a different type of plan, but a lot of us young nomads, that's what we're choosing.
Right. So the other considerations we've already talked about, you need to look for a large nationwide network on the plan in the places where you plan to travel. You need to also know what the out-of-network caps are. And the other consideration is the availability of plans in your state of domicile.
Very important.
So a lot of us RVers, we tend to choose Florida, Texas, or South Dakota as our state of domicile for other reasons. So whether it be vehicle insurance rates, registration of our vehicles, driver's license, income taxes, or taxing situations, those tend to be the top 3 states that a lot of us choose. And some people might choose the state where they originated from and to continue it as well. But it's very important to go look at what the healthcare options are that are going to give you a plan that gives you that nationwide network. And another point of consideration is if that plan will allow you to utilize that network when you are traveling out of state. You may find that some states and some plans put a cap on how much health care you can access out of your state of domicile. So South Dakota is running into this.
Yeah, we're actually running into a huge problem with South Dakota. We're currently South Dakota residents, and the healthcare options there are currently so poor for us pre-Medicare RVers that we will probably be forced to switch domicile. There is nothing really there that offers a nationwide plan. On the exchange, there's nothing at the moment. There is one off-exchange plan, but it is very pricey. So right now, for healthcare, South Dakota really isn't a good choice.
Yeah, there is one high cost plan. I think it's through Assurant.
Yeah.
That is an option, and there's
it's
some
off exchange. Yeah,
and there's also some short-term insurance options that are not ACA compatible. So you'll end up paying the fine on your taxes as well if you take that plan. But it is an option.
Yeah,
to consider.
That's something we're looking at as well.
But yeah, there's all sorts of considerations, and a lot of it comes down to selecting your domicile. And you have to kind of consider health insurance options becomes a major point now, and which state's going to work best for you. So if you want to research more about picking your domicile, I do have a link down there to our article on it.
Right. And also RVerHealthInsurance.com. That's where we go. He has a lot of good info there. You can get all your quotes there. You can look at the different types of plans that are available.
Right.
And another option that we actually also use is to cash pay for some of your services.
Whether or not you have insurance or not, this is an option.
Yep, and it's actually very possible to get good discounts if you pre-negotiate some of your pay, some of your care. You can actually get fixed pricing. You can get good discounts. It doesn't go towards your deductible, but sometimes it can make sense to go that route.
Right.
And we do use that.
Yeah.
We do that quite a lot for some of, for example, I get my moles checked every year, and it's well below my deductible, so I actually do cash pay on that. I negotiate a fixed rate for it.
And you have to call around to doctors in your area and find a doctor that's willing to work with you on that cash basis.
Very good point, yes.
And it just takes some time investment on her part to do that.
And I do have an article on that on the blog, so if you want to know more about how to negotiate cash pay, I have a whole blog article written on that.
Yes, and those links are down there on there as well. But, if you're in an urgent care situation, you may not have time to go and seek out the provider that's going to work with you on a cash basis. You may luck out that where you go for your urgent care or emergent care, they may work with you that way. But it's not going to always be an option in all situations. But it is one that, especially if it's a non-urgent sort of thing, like a routine check, you may be able to call around and get it done on a cash basis and save more than what your health insurance plan will give you access to their discounted rates, but it could give you even cheaper rates by just paying cash up front.
Yes.
To the healthcare. Now, can you pay it out of your HSA when you do that?
Yes, and you pay it out of your HSA, so you get an extra savings there too. So that's exactly what we do for a lot of our routine care.
And another option that some RVers do, especially since Mexico is such an option.
Oh, right,
and there's medical tourism where you can go across the borders and get access to first-rate healthcare across the border, paying cash. And getting access. A lot of them are even American doctors that go over the borders just for to get away from a lot of the insurance rates and the other accredited. They're still accredited. They're still gone through full training, so you can go and get dental care, medical care. Yeah,
and we actually get our dentals done every single year in Mexico, and I have another article on that on the blog. So yeah, that's another option. It's about a third of the cost for dental care, for example, across the border than it is here in the U.S.
Right. So that kind of wraps up health insurance and paying for it. Let's get into how do we find a doctor on the road, because that's oh my gosh, that's another headache.
Yes,
is my headache covered under my health care plan?
I don't think so. That's where the wine comes in.
All right. So if you have a primary care physician who is willing to work with you as a travel, great. Keep them.
Great. Keep them,
Getting established with a primary care physician while you are traveling can be a bit of a chore.
Yes.
When I started out on the road 8 years ago, I had a great physician. He was really on board with my nomadic lifestyle. In fact, he was a little envious of it. So envious that he ended up quitting his practice about 2 years after I was on the road, and I lost that access. I want to keep a primary care physician in my state of domicile, which happens to be Florida, because that goes into the whole establishing yourself in that state, which is really important when you're trying to prove that you intend to live in your state of domicile. But every time I go back to Florida, we might be there for a couple months at a time. It takes a while for a new doctor to book an appointment for a new patient to get established and then to get into whatever your routine care is. And I've gotten to, like, I've had an appointment booked months in advance. I planned my travel around it, and I get there and they have a cancellation, or they cancel my appointment, or I get there they're not able to provide the service that I needed. So for 6 years now, I've not had a primary care physician.
And we don't have a primary care physician. We haven't been able to establish one. So if you do have one, and you do have ongoing existing conditions or maybe prescriptions and stuff like that that you need on the road, before you go on the road, talk to your primary care physician about it. Try to arrange how you will get those prescriptions on the road. I do know people that get prescriptions through the nationwide pharmacies that are able to get their doctors to write 90-day prescriptions and so forth. So there are options if your primary care physician will work with you. If you don't already have one, well, it might be a little tough to get one established.
Right. So what do you do if you don't have a primary care physician and you need care on the road? Even if you do have a primary care physician, they may not be able to do much more than say on the phone, well, you need to go find a doctor. So what do you do? So a lot of us, we utilize urgent care clinics, which they're all over most cities have one. They're sometimes open 24/7. Sometimes they just have extended hours, but you can basically walk in and see a doctor. It's great for the sprained ankle. It's great for the
any kind of minor thing, and it's inexpensive. If it's not an emergency, obviously, if it's an emergency,
go to emergency.
If it's not an emergency, really, urgent care is inexpensive and it's easy, and you will get care in a very short period of time. And we've utilized them a lot across the country.
Right, and they can also do referrals to specialists in the area if you need further follow-up care. So even if your insurance plan may not require that you have a referral, it's very possible that the specialist you want to see requires you to be referred from another physician to get an appointment. We ran into that earlier this year with a medical situation with Chris.
And you got it through the urgent care?
We finally had to go through an urgent care clinic. Even though we knew exactly what we needed, we finally had to go through an urgent care clinic just to get the referral for them to make the appointment with a specialist we needed to see. Another is telehealth is an up-and-coming trend.
This is totally new.
So these are virtual doctors. I mean, they're real doctors, but you access them virtually. So either by email, video chat, or even phone consultation. And that might be great if you come down with a respiratory infection, a UTI.
And you just need an opinion.
You want an opinion?
Yeah, you just want to talk to a doctor, get an opinion. Sometimes they can even do, I understand, prescriptions if they're...
they can diagnose you over the phone or whatever. They can actually call in a prescription for you, which is a great option if you're out in the middle of nowhere or away from getting in to see a clinic or whatnot. There's even ones like Kyle at RVer Health Insurance has set one up with Teladoc. He negotiated a plan that he sells to RVers, and it's
there's
like
a monthly fee for it.
It's like under $18 a month, and it gives you unlimited access to this consultation service, which is something Chris and I intend to set up here shortly, so that we have access to that for just calling in for consultations, just to get a second, sometimes just the opinion of like, do I really need to seek out more extensive care? It's just.
It doesn't replace your primary care physician, doesn't replace an emergency situation, but it can be a really good supplement if you're in the middle of nowhere and you really have no access otherwise to doctors. Right.
And there's other services that have come up, Doctors on Demand, MD Live, and there's others of those. In our healthcare article, I have a link to a whole list of them. And they offer different varying ranges of services where you pay sometimes maybe $45 for a consult instead of paying a monthly fee to have access to it. But, you know, the ones where you kind of keep your healthcare records online and then they can access them and look them up, and they have a little bit of history of you when they're talking to you.
And that actually brings a really good point about keeping your own healthcare records. Being that you're a nomad, you're not in the same place, you don't always see the same doctor, it's really important to keep a record of your whatever you do with healthcare. Your blood tests, your results, your accidents, everything. We keep them in a file. We also scan them online so that we can access them anywhere. And how do you keep your records?
Well, we haven't actually seen doctors in quite a while, but we pretty much just keep electronic copies of our own records. And we keep them in Dropbox so that we can access them from whatever device that we might have when we go in to see a physician. And so, yeah, when Chris had his procedure done earlier this year that we finally got in to see a doctor for, we just asked the hospital for a disc with the results on it. So
you can always ask for your records. You have that right to ask for a copy of your records, and I recommend you keep them.
Yes, have those handy on it. We're going to be entering into our third section, which will be the last section of us talking.
Yeah, we're almost done.
We're almost done, which means we'll be opening it up to question and answer very soon. So if you do have questions that you would like to ask us, go ahead and start queuing those up. Chris will be keeping track of those and referring those to us once we get through this last small section. And then we'll be happy to address them. Just keep in mind that we are not doctors. We're not insurance agents. We cannot address your personal situation more than likely. You do need to probably consult with an agent of your choice to go directly for that sort of stuff. I did want to also mention another idea of what that we ran into. This is something I didn't mention to you earlier, is some credit cards have a concierge service associated with them. So our signature Chase card has it.
Oh, interesting.
And there was one time when I woke up with a really bad toothache. And we had really bad cellular service where we happened to be staying. So instead of calling around to all the local dentists in the area to see if they could get me in that morning, we actually called the concierge service, explained to them the situation, and said, and they went around and called around and found us and penciled us in at a couple different appointments at dentists that could see me that morning. So
smart little idea.
So that's another option.
We had no signal and it worked wonderfully.
It worked wonderfully. So we would do that again if we were in a situation where we needed to find a primary. Let someone else do the calling for you.
Yep.
All right.
I wish they had more of that.
I know. All right. Last section is on self-care.
Oh, self-care. So, I mean, you know, as an RVer, you're kind of taking responsibility for your own life in many ways. And I think healthcare becomes part of that. Basically, there's a lot you can do with your own pocket without seeing a doctor, self-healthcare. That is very valuable and that can complement your doctor visits. For example, we get full comprehensive blood tests every year without seeing a doctor. We order them online. There's a bunch of organizations that do that. For under $100, you can get a full comprehensive wellness check.
And there's the links to this in her series.
Right. I have a series on self-health care. There's also, we carry a blood glucose monitor, which we got inexpensively at Walmart. Diabetes runs in my family, so I've actually been testing my blood sugar for years. We keep a blood pressure monitor. There's a lot of different things you can do to monitor your own health on the road without waiting for your yearly doctor's check, if you want to look at it that way.
Just keep on top of your monitoring, and then if you find something that's out of balance, then you know to go approach and find a physician or a provider who can help you out with that situation and provide the updated care that you might need.
Right. And just generally staying healthy on the road, eating healthy, exercising, all those things, of course, go towards being healthy in general.
Right, yeah, just taking better care of yourself. It can be easy sometimes when you're on the road to get a little sedentary. So, you know, getting out there and having the excuse to go out walking or hiking and biking and staying active, eating healthier and choosing organics and, you know, whatever, and knowing what works best for your body.
Right.
Don't, you know, just because, you know, your friend has gone vegan doesn't mean that that's necessarily the best choice for you.
We do a lot. Paul and I do a lot of experimentation on our bodies and what works for us and what doesn't work for us, and that's part of why we do self-health checks
to monitor what the progress is and what your blood levels are. You know, so, and of course, even if you're doing everything 100% perfect and being completely healthy,
there are no guarantees.
There are no guarantees that that's going to prevent you from having an issue while you're with your health. And you know,
which is why we carry health insurance.
Right. So, but you have to pick for yourself. You've got to choose what your own risk tolerance is for paying premiums versus taking the risk that you might have a huge out-of-pocket expense down the road.
Right.
Anyway, it kind of wraps up what we had prepared.
Right.
Does that mean it's wine time?
That means it's wine time. Yes.
Wine and questions.
Because wine has resveratrol, and that's really good for your health. It lowers your blood pressure and does all kinds of good things for you.
So cheers. Here's This is Menage a Trois for...
Perfect.
Yes.
All right. So, do we have any questions?
Yes, we do have some questions.
Questions.
Okay, we have a question here. Let's scroll back. From Chris Agro asks, can a domicile primary physician prescribe medications outside of the state that they are in? I think physician can prescribe.
I think
Yes.
there's certain. I think there's controlled ones that they might not be able to.
I think, yes. I think it depends on the prescription. Like, there's certain controlled narcotics that maybe they are not able to do. But there are, I have heard of other RVers who get their physicians to prescribe, say, 30 or 90-day prescriptions, and then to renew the prescription, and then they go pick it up at a nationwide pharmacy somewhere. So I do know people do that, but there probably are prescriptions that are restricted.
Right. I have not had a prescription in years. I don't.
Yeah, I haven't either.
That's not something
yeah.
I've navigated.
Yeah.
I prefer to treat everything I can through nutrition and health as much as possible. And
But like a lot of the nationwide pharmacies, you can get your prescriptions at any
You can
place.
get
Like
your
if you have a
prescription
Walgreens and
anywhere
stuff,
at a lot of the nationwide pharmacies. Yes, as long as the doctor phones it in, you can then go pick it up at any town.
Right.
Yeah, and I've done that in the past for when we've had issues happen and I had to pick up a prescription. Yeah.
Right.
Max D. Case asks, are large cities or small city doctors easier to work with?
Oh, goodness. I think it totally depends.
I don't think that you can make a distinction by large or small city. I think it's regional. I think it's based upon the doctor you happen to get with. I mean, just doctors are people, and you know, some are really good, and that's one of my frustrations with trying to get established with a primary care physician is not only do you have to time it with your travels, you also have to find someone you click with.
Yeah, so I think it totally depends on the doctor. Like, for example, are they techno-enabled? For example, we would love to have a primary care physician doctor that we can deal with through email, chat, stuff like that. But just depends whether or not the doctors, you know, they're in on the latest technology or not. So,
and sometimes a rural doctor may be more in on technology just because they're used to working remotely with...
And they may be more relaxed. You just don't know. It really, unfortunately...
It doesn't come down to something that simple, I don't think.
I wish.
Cool. We have a comment from Joan Moore. She says when she had pre-Medicare, then negotiated the price of visits, they were told by their insurance company they could submit the papers and have that count towards their deductible.
Ah, that's good to know.
Oh, very good point. Yes, actually, I think I have heard of that before. So thanks, Jill, for that.
Joan.
Joan is also her name.
Yep. Yes. Okay, so question from James Zimmer. For any of the military retired, do they ever have problems getting care while they travel?
Oh, I actually don't know too much about the
Retired,
VA. Yeah, I do know there are people on the road that obviously work with the VA. I don't know exactly how, I'll be honest.
No, we're both obviously pre-retirement age, so that's what our focus is on. But there are definitely go on the escapees forums or
the forums. Yes.
A lot of the forums, there's a lot more information out there for retirees than there is for us non-retirees because there's been so many folks who have navigated this over the years. So there's a lot of resources out there for that.
Yeah.
Okay. Deanna Stock asks, do the teledocs handle maintenance messes such as cholesterol?
I have no clue.
I think it depends on the teledoc service, from what I've read.
Yeah, if you can get a teledoc service where you have one physician that's kind of appointed to you, or they're monitoring your health, I don't think they really replace care management, which is kind of what you're looking at there.
Yeah, they're not really a replacement for a primary care doctor. They're more kind of a consultation thing. I wish they were, because that's exactly what I would love to have.
Yeah, I would love to have. Kyle explained it to me that was more like the health concierge service.
Yes.
Where you have a healthcare provider that is more like a primary care physician working with you directly. And he says he does not know of any currently that are nationwide geared towards us that way. So that's my wish.
Long-term maintenance, things like that, when you're looking at, monitoring your health on a regular basis with a doctor, you probably need to try and establish with a primary care physician
who's willing to work with you remotely and do ordering tests remotely and stuff like that.
Yes.
Now we got a good pro tip from John Baker, who says, do what he does. Travel with a trained and experienced nurse on board.
Oh, that would be cool.
That is even better.
Yes.
Cool. If he or she cooks, cleans, and let's see, also does blogging for us, that would be great.
Yeah. And actually, can the nurse actually go online and become a primary care physician? That would really be helpful.
Yes. That would be, there's such a market for that. And I really hope, maybe there's a doctor out there looking for a
Yeah, there might be a doctor out there who's
who
just
wants to go
looking
RVing and
to
wants
take on the RVer
Oh,
community.
gosh.
We're here for you.
Yes, unfortunately, it gets complicated with state licensure and stuff like that.
It does.
So.
J Dog comments, asks if you could comment on smartphone apps that help with medical care, and says that he uses iTriage.
I've honestly not used any because I'm not actively tracking anything on myself right now. So
No, I mean I monitor my steps. That's about it. We do our blood tests every year. We do ourselves, and we keep records of those. We put them in a spreadsheet. I'm sure there's better ways of doing that. And I haven't tried any of the new apps.
I'm very blessed right now that none of us are really tracking anything big that I'm...
Just our steps.
Yeah,
Yes.
we track our steps.
I use the Red Cross app for first aid, looking up first aid stuff. I've used that app in the past year.
Yeah, but not for tracking
Right,
stuff
not for
like
tracking
that.
stuff.
I mean,
And-
Fitbit,
This wasn't for tracking. This was for apps for medical care, and he referred
Okay.
to iTriage. So,
Oh, okay.
So it's
Okay.
any kind of apps.
Okay.
I actually, I haven't used any.
There's a lot out there, though.
There's a lot
Yeah.
out there. I will read reviews.
Yeah.
Maine Bob O'Connor says, I sent an email to y'all about Maine Community Health Options Co-op. They're associated with First Health Network for in-network coverage out of state. Do you know about them?
We're really focused on the RVer-friendly states, Florida, South Dakota, and Texas. I don't know. We don't really track too much close to the other states because they're really not relevant to most RVers.
Yeah, I don't know. Don't know anything about them.
Do you consider Florida a good option for plans?
Yeah.
So Chris and I moved to Florida about 2 years ago. We were with South Dakota, and there's a myriad of reasons why we moved to Florida, but one of them was healthcare access. We did have trouble getting a plan established there that was on a nationwide network and had to kind of jump through some hoops to do so. We're in Florida, and there are, I think, 2 plans that are on the exchange and multiple that are off the exchange that do have nationwide networks. So we do consider them, and I believe Kyle will also confer that Florida is a great state for nationwide traveler plans.
Yeah, actually both Florida and Texas right now have excellent options. The only state that does not is South Dakota.
Yes.
So we're getting a lot of people saying how informative this is and how awesome it is, and
Oh, good.
a couple comments on your healthcare series too. So
Oh, good.
good praise there coming in.
Well, thank you. We definitely appreciate the praise.
Yep, we're here to be helpful.
And J Dog would adds a comment that his doctor has never had trouble sending prescriptions anywhere in the country for him.
Great.
So
I've heard that
confirmation on
before, so that's great
Right.
to have that confirmation.
Right. Yes.
If you find the right doctor, you can work all
Right.
these details.
Right. Some doctors just don't. They just don't have time for it.
Yeah.
So Catherine asks, do you think there will be some changes in healthcare over the next year or so due to healthcare reform?
I don't know. That's
I don't know that we're really qualified to answer that. I right now, whatever goes on the exchange right now will stay on the exchange for the next year. We're likely to see things pretty much be the same next year. What may change more likely is insurance companies either going on and off the exchange, offering different kinds of plans. But I don't know that I would be able to.
No, I don't have a magic ball, and who knows what will happen in the political sphere that might impact it. The best thing to do is keep updated on it. RVer health insurance, I just cannot stress just how important of a service it is that Kyle offers. He's moving more to being an informative source. He is an agent and can get you hooked up with plans in Florida and Texas. I believe he just pulled out of South Dakota because of the lack of options. Except for Medicare, he does still offer Medicare plans up there. But he's keeping a track on this all for us all, and
that's where we get most of our info about what's happening.
Subscribe to his newsletter, and keep informed of what's going on out there.
Yeah.
So George Morrow says he sees a market for doctors and medical advisors operating through our village. That could be a kind of
that would be awesome.
Yeah.
I would love it.
I don't care where they operate out of. Please, just I would.
Yeah.
My dream would just to be able to have a personal physician who maybe I did go and see once every few years in person, that would be willing to work with other physicians for testing and going to see, and could hook me up and get us in the front door sometimes into a doctor that's not an urgent care doctor.
Right.
Just to go and follow up on stuff. I'm sure as we all age, I mean, I'm in my early 40s. I hopefully have a few more years ahead of us before we have to start worrying about it too much. But you just never know when something can crop up in life.
There is no guarantees.
That is something that worries me, is, what happens if a chronic condition comes up that we need to monitor over time.
Yeah.
Okay. We have a question for Nina. Now that South Dakota is no longer going to work for you, are you leaning towards Texas or Florida, and why?
I think it changes daily for you.
Yeah, it kind of changes daily. It's Florida and Texas are very, very close in terms of the healthcare options that they offer, in terms of the insurance rates for car insurance rates.
The logistical hoops.
The logistical hoops. Texas has got certain advantages because they are a legal address. Escapees specifically as a fought for to be a legal address there. But it also has some negatives in terms of we'd have to take a driving test for our Class B non-commercial driving test for our rig. Florida has some advantages too, and some disadvantages. Some of the healthcare options are actually a little more expensive there. But with subsidies, they can be less expensive. So you can see, I really don't know.
She's changing. We've been talking. We almost have a daily chat about this.
Yeah, it's a daily chat, and we almost. I'm getting there. When I know, you'll know.
All right. So we do have technomadia.com/domicile. Goes over all the considerations when selecting a state as an RVer.
It's a really good article.
And there's a lot of considerations. Healthcare is a major one for those of us that are of non-Medicare age, but there's so many other things: vehicle registration, insurance,
business. If you're running a business,
if you are anticipating inheriting things, and you know, just how things are treated, and your power of attorneys for that you might have impacted in other states for the care of your loved ones. There's a lot of things that you really have to take into consideration.
P. White asks, where do you ladies get your mammograms and yearly checkups?
So yearly checkups, I actually do. We mostly do self-health checkups. We get a yearly comprehensive blood test that I order online and I go pick up. We have a couple of other blood tests that we do ourselves as well, and I get a yearly dermatological review that I basically set up wherever I'm traveling. I negotiate a cash pay for that, and to be honest, I have not had a mammogram.
I've not had one in over 10 years. Mainly just because we're not stopped long enough to manage all that and go through the hoops of doing it, and it is something that I need to do.
Yeah, and it's on my list as well.
It is. I don't want to do it while I'm in California, because I don't want, you know, it's very careful about where you do your routine medical stuff at. You know, counts in how states see your domicile and intentions to be residents there. So I try to avoid doing anything that is non-touristy in California. So we're going to be in California through the end of the year, so that's not an option for me. So maybe after the first year we'll find somewhere. But yeah, I know Chris and I we're both long overdue for routine checkups and things like that. So yeah.
But basically the way, you know, when I get around to doing it, I'll be looking at what providers are in an area, try to line up when I can get in to see a provider, when I'm in the area. That's how I do my mole check every year is based, but I do that one cash pay. The mammogram I'd be able to take through the ACA if I have an insurance.
Right. Yeah. So yeah, for us, it's next time we know we're planning to be stopped somewhere for a while is trying to arrange it all. Life gets hectic when you're on the road and you get lots of projects on, and it's amazing. Even if you think you're going to be stopped somewhere for a month or two, just how quickly it goes by and how many things just don't get done.
Yeah.
Okay, so we have Chris Agro asking, are there any Obamacare plans that are nationwide?
Yes.
What are...
I think coverage networks and stuff.
ACA plans, I mean, so Texas and Florida both have excellent nationwide.
So go to RVer Health Insurance. He specifically is tracking them all. He's researching them all. He is talking with the companies and updating as he learns stuff. If you click on there, he's got a section where he overviews each of the Florida and Texas and I think some others.
Yeah, and he actually goes through each insurance and says, okay, this is a good plan for RVers. This is not a good plan for RVers.
This is why. So go look at them. There are plans out there specifically in Florida and Texas that do have nationwide.
Yeah. I believe in Texas on the exchange there's BCBS, and in Florida on the exchange or Assurant. Those are both very good options, and Kyle probably has more recommendations on his website. So yeah,
I'm going to defer that one to RVer Health Insurance, and just go there, because even if you're watching this 6 months later, what we're saying now about specific plans could completely change. So definitely research it when you're ready.
Okay, Craig asks, is it worth keeping my existing insurance provider if I decide to start traveling, or should I look for something more nationwide?
Really depends upon what your current plan is and what your risk tolerance is. Look into see what's offered as a traveler, what they consider emergency care, how much care they'll give you outside your network if they have a nationwide network.
Is there an out-of-network cap?
What are your current health conditions? You really have to assess your own needs. Don't trust two babes on the internet to tell you what to do.
Okay.
True. Especially when they're drinking wine.
J-Dog has another question. Any guess on what percentage of the time you're paying cash for services versus having insurance help cover? How often is insurance actually working out for RVers?
I have not asked other RVers. That's not something I know
So
statistically.
it depends on your individual health, right? And whether or not you have any accidents during the year. We have actually cash paid 85% of what we've done over the past 5 years. We very rarely use insurance. Actually, in fact, I may only have used it once when I ended up in the ER because I smashed my head on the side of the slide and I was bleeding out the side of my head. And in fact, I may even have renegotiated that as a cash pay. So I would say maybe even 95% of the time we've used cash pay. But then we don't have any ongoing medical conditions.
Right.
You know, I'm not currently being treated for something on an ongoing basis. I haven't been in too many major accidents. That's when I would need insurance. Yeah.
It's there for emergencies.
It's there for emergencies. I mean, we have insurance. I think you, like us, have insurance for the catastrophic case. We're looking at the worst case scenario. We have a really major accident. We have a really major health issue. That's why we carry insurance. So we don't use it most of the time.
Right. So, I mean, in the times that Chris and I have used our insurance, we've never exceeded our deductible. So we are paying out of our HSA account. So it's basically, but we're just not negotiating cash
we're paying
pays.
tax-free then.
Yeah. So we like the HSA because we put the money into the HSA and then that gets written right off below the line on our taxes. So we just look at it as it's tax-free medical spending.
Yeah. I mean, our neighbor just down the road, Glenn, he had a major emergency. He had his appendix rupture, and he used his insurance, and it worked out. Yeah. So
I like to have my money applied towards my deductible so that if we go in for a test or something of a concern, then that money is already towards the deductible, and when we get around to treatment, it's already towards it, you know. But you know, if we can submit past receipts, that's also awesome too.
So there's a comment that people are enjoying Kiki's walkthroughs. So Kiki, get back off. You know, do your walkthroughs. George Moreau points out that yes, he's had very good luck negotiating with doctors with cash payments, well below normal rates.
Yep, me too.
And let's see, anybody else who's got questions, now is the time.
All right. If you've run out of medical or health insurance questions, feel free to ask questions in general about life on the road. I think Nina and I are both willing to field some questions. So if you want to talk about anything else about life on the road, we'll open up to general Q&A if you like. So keep your questions coming. We'll stick around for a little bit longer if you've got them. And of course, if you still do have healthcare related questions, I guess we can regress.
Yes, we can.
John Baker passes on a suggestion to people to investigate catastrophic plans, particularly plans that are focused on catastrophic cancer plans. These will keep you from losing everything. Right. Catastrophic plans under the ACA, however, are only available to people under 30.
Right.
Otherwise, they do not qualify for ACA coverage or being qualified, so you do pay penalties on top of that.
Yeah. So you may be able to find a supplemental insurance that does that, but it will not qualify for ACA, so you end up paying the penalty. But it may be something you could look at supplemental insurance.
Yes, you may be able to look at a catastrophic plan plus the penalty, and it may be cheaper for you than the premiums, and it just all depends upon your risk tolerance. Yeah. There's also traveler's insurance, like World Nomads offers a plan that covers you. I think it's up to $100,000 a year. For anything that happens after a certain mileage from your home base, from your domicile address. So that could be an option as well. It might cover the gap for you.
Right. Get you back to your home base if you end up in a situation where you're in a state or you're in a plan that has a limited network and you need to get back to your home base. Having an insurance that will take you there could be a possibility.
Right.
That,
It could be a
that would
good
help.
supplement to a plan. Like if you wanted to keep your employer's plan that only
Right.
gives you local coverage, it may give you the coverage to get treated while you're out and about and then get back to your home base.
There was another comment also about carrying accident-only insurance that covers you just for an incident. This person mentioned that, I think it was Greg Morrow, had $15K per incident, and I actually used to have that as a rider on mine, too.
Yes, you used
Oh,
to.
okay. Well,
Especially
when does that insurance come on?
It didn't. It comes on immediately.
Right.
But
So
as a rider on your auto
right.
insurance, or
No. It was
ours-
on my health insurance.
ours
Okay.
was a rider on his assurance plan. This is when he was doing active paragliding. So we figured that the most likely incident was he would
Break
fall
a
out of
leg.
the sky.
Yeah.
And so we carried that on his plan. So that meant that immediately before deductible, I think it was like $15,000 would have been covered
Right.
under the accident before we had to go through using the plan.
And it was still HSA compliant, too.
Well, this was pre-HSA.
No, I had my HSA then.
Yeah.
Yes.
okay, all right.
Yeah. So that
That's
was
another good option.
an
So
accident
I guess
plan.
lots of supplemental insurance policies that we haven't looked at really.
Any other questions over there?
Somebody says to Cherie, do it ASAP. If you're headed to the Southwest, Mexico will be handy. I'm not sure what they're referring to, though.
Probably self. Yeah. I'm not too keen on the Mexico thing myself. So.
Yeah, we go every year.
And lots and lots of people say they really love the live stream and the live stream format versus Ustream. A general question came in from Andy Hull. How do you consider choosing a domicile and establishing a business?
So look at our article. So the
Yeah.
question was, how do you go about choosing a domicile? That'll actually be a whole separate chat topic that we'll probably do one time. But the article's at technomadia.com/domicile, and that walks you through all the considerations that you need to ask and the research that you need to do.
Yeah, it's a long
It's
topic.
It's not something we can do as a quick question here, unfortunately.
Okay, now we've got a bus question came in from Craig Gatlin. Says, I'm a new bus nut, so my question is, do you stabilize your rig? Shake and rattle, shake and rattle.
We have no stabilizers on our bus.
Our bus has air suspension and is such a heavy vehicle that it stays pretty stable without any sort of manual jacks.
Yeah, but
Yeah.
it
does rock a little.
It does rock a little. I know when Chris is up and about getting into the tortilla chips at night. So.
I can hear the cat bouncing around sometimes
Yeah,
too.
so
Feel it.
it's just something we get used to.
So is it on your wish list? Stabilizes?
There's really no way to stabilize it.
Oh,
I
really?
mean, you could put jack style things
Right.
down, but no, I mean, it has never. It's not like a small, particularly like a fifth wheel or something where it rocks like crazy when somebody walks around. It's very subtle.
Okay. Any other questions?
Okay, Mark Ewell asks for both of you guys, is it okay to, quote, drop in when we are near, or is that discouraged? We'd love to meet you.
Write us in advance. It's much preferred.
Yes.
I'm an introvert in particular, and we're morning people. We keep long hours. We do enjoy meeting people. Do not mistake that. But we do much prefer it being a scheduled time in advance.
But we also do love serendipity. So if you see us, say hi. Don't write to us later and say I saw you, but I didn't want to say hi.
But please don't come and knock on the door.
Yes. Don't knock on the door.
But if you
particularly
see
in
us
the
out and
mornings.
about, say hi. But if you are in an area you know that we're here, I think you prefer that as well. I
Yeah.
much prefer being written to in advance and saying, hey, we're in the area. Can we get together? Contact us on our village. Write us. We do love making time to meet people, but we also do have a lot of other things on our plate. So,
Last call for questions.
all right, is that it for questions?
I think this is it here. There's a 20-second tape delay, so we'll give them a few seconds to get there.
All right, so go ahead and send in any last questions. It will be the last that we take. We do appreciate you joining in. We hope that live stream's been a much more pleasant experience than Ustream was. If you do appreciate these chats, these are our gifts, our time, sharing our knowledge and our time here. But we do also enjoy a glass of wine. If you would like to add to our wine fund, you can PayPal us at contact@technomadia.com, and any money received this evening will go to taking. It is Nina and Chris's birthday next week. It will go to taking them both out to a great dinner and with margaritas.
Oh, good.
So please. We don't expect it, but we definitely do appreciate the thanks for our time to do these to take the time to do these video chats and share what we've done. So if you would like to contribute, just PayPal us at contact@technomadia.com. There's also donate buttons on the bottom of our website as
We've
well.
gotten a lot of great thanks coming in. Two final questions. It looks like one is, have you tried Menage a Trois Midnight?
Yes, we
Yes.
did. This is the
This is
regular.
not it. But
This is the regular.
But Chris and I did try the midnight the other night, and it was pretty yummy.
Yes. Yes. Good wine.
And then a practical question: what are some of the key things in your first aid kit for self-treatment on the road?
Oh, so first aid kit. Well, I mean, we keep disinfectants, peroxide, swabs, bandages. Those are probably just kind of a basic first aid kit that we keep. The treatment kit, I mean, we do have blood pressure monitors and all that stuff, but it's basically just basic first aid.
Right.
Like you would buy a packaged first aid kit.
To handle the things that I know how to handle.
Yeah, I don't think we have anything... I'm trying to think if we have anything special in there that would not come in a regular first aid kit, but I can't really think of anything that we would have.
No, I mean, obviously...
We have tweezers, stuff like that.
Duct tape.
Duct tape and WD-40. Oh, but that's for the bus.
Yeah.
I mean, obviously, if you have a medical condition or a propensity towards certain calamities, obviously know what you need to navigate your situations. We're the four of us are pretty healthy people.
Yeah,
so.
and I mean, we do take supplements and vitamins and stuff like that. There's a lot of self-experimentation that I do with food. But yeah, first aid kit, it's pretty basic.
Yeah, we keep the basics on board as well. And if we had medical conditions that we were treating, then we would have other stuff.
Cool.
Are there any?
I think we're wrapping this one up here. So
All right.
Final toast, and thank you to everyone.
Thank you, everybody.
For joining us, and we'll see you next month.
All right.